Hello, my name is Stefan Wallace, and I am the Director of External Relations for the COVID-19 Prevention Network and the HIV Vaccine Trials Network, among the many other hats that I wear. And today we are here to talk about the differences between HIV and COVID-19 vaccines. And in particular, we want to have this conversation in the context of the fact that we are also still celebrating the commencement day of HIV Vaccine Awareness Day, which is May 18th. So, as we are all likely aware, if we've been paying any attention to the news as well as to our local communities and families, that we have been through a pandemic and we are still navigating our way through this pandemic that is COVID-19. However, before COVID-19 became a reality in our lives, we were also still navigating a pandemic that is HIV. And so with both of these, there have been progress made, and certainly much more so on the COVID-19 side. And so part of what we are going to discuss today is a bit about some of the differences in community perspectives and the trials, but also seeking to have some general conversation around what does all of this mean in the context of our lives and how we might need to be thinking about this with respect to how we move forward with HIV. So to kick this off first, I'm going to invite one of our guest, a special guest, Dominique Jackson, who many of you may know. She is a model, author, and actress on the hit show Pose on FX. And she also happens to be a ballroom icon, a Hall of Famer, someone that I admire and look up to and respect immensely. So welcome, Dominique.
Hi, Stefan. Thank you for that. And the feeling is so mutual because I just feel the same. I remember our conversations in Dallas at the Beehive, and it was just amazing. And I admire your work and I'm so grateful for your work. And like I said, to see that PhD behind your name just makes me feel all amazing and honored and proud and everything like that. So
I really appreciate that. I really appreciate that. And, for folks who do, who are watching this, like, this is actually how we are with each other. We're not like we're not putting on for the camera.
Yeah, this is how we are.
But thank you again for taking the opportunity. I know that you are incredibly busy with all of the projects that you are connected to. So I guess we should probably start with a little bit of that, talk to the audience about what's going on with Dominique.
Well, actually, for transparency, and because it's you, Stefan, I'm going to talk to you like how we spoke back in Dallas, how we talk all
Got you.
the time. So, a chick was feeling I was feeling everything.
Yeah.
It was a lot. It was overwhelming to have to be on pause, relive actualities and realities and trauma, and then COVID. And so it was just, everything was just there. And around, and then with the work schedule on Pose, you're like learning new lines every day. And of course, ballroom. So I have to show up. So I'm up. I'm working 15 to 17 hours a day, including travel and, commute. And then I have to learn these lines that are coming in the day before, at times, because we really want the best. So I kept saying I was tired. And by the time the premiere came along, it's where everything just started to come back to me. I was burnt out. Then, of course, they say, you can't eat for 3 weeks. And I looked at them and I go, you're crazy. And at the end of those 3 weeks, my brain just automatically just went back to the trauma of modeling and, only being able to eat the cheese on the pizza after working for, another 20 hours, and, I was in this space of, I was just burned. I was tired, stressed. My body ached. And I hit it to Hawaii. My fiance, one of my sisters, that came to really support me, and it made me realize how important self-care is. So that's why I am right now. I am in the process of caring for me while understanding that I still have to work. But now I'm able to say no. I'm able to say, no, I can't do that this week. If we can't do it next week, then no. I had a schedule right after polls in April. I worked every day with colleges, reliving my trauma, reliving my life, and it just kept piling up. So now I'm in a space of take your time, relax. Hawaii was amazing. I got to just take it in and breathe, and then I came back home and was able to really actually realize and enjoy the fact for the past 2 days that I do have a house. We have a home, so all of these, so that's where I'm at. I can't work all the time. I cannot commit myself to the traumatizing situations all the time. And we have to get rid of imposter syndrome and survivor's guilt.
Absolutely. And congratulations again on the home. When I think about imposter syndrome, I just think that, it's just another sort of example of how white supremacy continues to wreak havoc in our communities and challenge us in our ability to even imagine us being more than we can even imagine for ourselves.
That is so true. That is so true. That narrative plays down, and sometimes you have to think about the influence that it has had on us, where we have settled in this space of, and you don't hear it until you're actually standing in a space of not being consumed by your own trauma and not being consumed by your own, pursuit of your happiness. And when I hear my sisters speak about what they aspire to, and I think to myself, that was me. When you're just thinking, oh, you know what, all I want to do is get off the street and get into a house. We don't think, and when you speak of white privilege and supremacy, we are not raised thinking that a home is just, oh, you buy a house. We're thinking move out, get an apartment. And some of us didn't even grow up in houses. We don't know what it's like to live in a house and have a backyard. So when we achieve these things, at times we feel, and that brings me back to something we used to do in ballroom. And that is when we would say, oh, she's white woman. From the beginning of time, that always irks me because I had to say to one of my friends who's actually Jewish, very much older than I am. And he said to me, oh, you're the whitest black girl I know. And I'm like, wait a minute. It's according to this marginalization and oppression that some people are not offered education. And some of us are actually happy with the way we speak, the way we relate. So don't come in and think it's something less than. So at times we're made to feel that we are less than. And that's where that plays in a lot. Like I was walking down the street in the mall a few weeks ago, and I saw a group of young black, boys walking towards me. And systematic oppression, right? And realizing that now I'm in a different space, subconsciously, I grabbed my toe and moved it to the other side. And I had to check myself in that moment. I said, wait, where's this coming from? And I see how this has played out across the board in the way we treat each other, in the way we speak to each other, when we think we have achieved success. We don't see it as success for us that is deserving and rightfully ours. We see it at times as us moving into their world. We're not moving into anyone's world when we become successful. What it is that we are successful in our own right. And therefore, we have to appreciate that from within us and amongst us and not think that we're better than.
Toni Morrison, one of my favorite authors, next to you, of course, often talks about the white gaze and how whiteness is often centered in every aspect of our society. And it's often used as the barometer right? The measure by which everything else is assessed. And so when you made the comment about, white woman or whitest black woman, like that, it resonates with me because it just reminds me that that in this country, that and in many places around the world, actually, how whiteness is centered and everything else is sort of measured around it.
Yes.
Absolutely. What I guess given the topic of HIV, what can you say HIV/AIDS or HIV Vaccine Awareness Day means to you?
Oh gosh, it means that we're really doing something now. It's not just talking about it. And it's sad that it has taken this long. It's sad that people have to see television shows and documentaries in order to understand that this is something that affects each and every one of us. You may not be infected, but we're all affected, And it is from this that we have to learn what true brotherhood and sisterhood and true family is. It's from this that we have to learn what being a human being is. And this awareness means that we know that this is happening. We know that there's a possibility for a vaccine. Why is it taking so long? Why do we have 35 million people now dead because of HIV and AIDS complications to date for 2021? Why is it that we had to go through all these things with trials where some people could get medication and some people couldn't, but yet these same people that were getting the medication were coming into our Black and brown communities and fetishizing us and purchasing us and infecting us? This awareness, it means that my kids are going to understand that this is not something that they have to hide. It's not something that's taboo. It's something that's in the world, and we're working towards making it better, which is what we have to do. I have seen firsthand, what happens to someone. I myself was thinking in the beginning, and I know I probably told you this story, where from 93 to 2000, I thought I was infected because of my size, because of the people, because of my community. I would see people show up, and 2 months later, they're half my size. The face, that would not have happened if we had put more effort into this. It would not have happened if we didn't look at this as something that affected only a certain type of people and realize that it affected everyone across the board. Like, I was shocked in reading that from 1980 something to 2021, 35 million people. And now we're only still at just an awareness day, but it's a start. But there's a lot more work to do. Let's get from being, and this is what I tell people all the time. We don't realize that when we bring our traditional beliefs and our traditional beliefs that lay in segregation, that lay in us still looking at people's skin color and social status and all of that stuff, and instead of looking at these people as human beings and say, we need a cure, we need to work hard. I heard that there was something done, I believe, in one of the countries in Asia where they did issue vaccines to people. I don't know how true that is, but I've been doing some reading and it has had some effects, right? But this has to be a worldwide thing. It has to be everyone coming together, because at this point in time with 35 million people, and I keep stressing that because I want us to realize 35 million people is is more than an entire city. It's more than some villages. But I'm from Tobago. That's my whole island. We don't even have 35 million people there. That's like genocide. You're wiping out, and then you're saying we're working on it, or we can't find this, or we can't do this. But yet certain classes of people were able to come up and get treated. I can't say much more because then I'm going to do too much and it's going to tie into our season of polls. But I will say this, a lot of this is addressed in this season as we have been addressing it before. With Billy Porter now coming out, people have to realize This is your brother, your sister, your niece, your cousin that you used to play around with. Sometimes your mother, your father, you never know. We all have to be invested in this, just like we are invested in COVID-19. Because guess what? We're invested in COVID-19 because what? We all want to get back to a normal life. So think about that for someone who is infected or has been diagnosed with AIDS complications.
Absolutely. There's a study that you referenced about, I think you were talking about the study in Thailand, and it used a product called RB144. So at the onset of the earlier stage of the trial, we saw about 66, 67 or so percent effectiveness or efficacy rather for the vaccine. But toward the end of the study, it dropped down to about 33%. And so the challenges are many with not just designing vaccines, but also conducting the trials. And I do think it's critically important that we work to increase our own understanding of clinical trials and of vaccines, because the truth is that to get this is going to require all of us to be involved. Because this, as you mentioned, HIV is a disease that impacts everyone. And I think part of what we've seen, particularly in this country, is we've seen people sort of distance themselves from the topic of HIV because they perceive that it only impacts certain groups of people.
That is true. And it's so very unfortunate. I recall in 2013, when we were just losing our ballroom people back to back to back. It was like every 2 weeks there was someone going. And then being in the show world and being in the ballroom world and being in the nonprofit world at that time, it was every week there was some beautiful young person just, gone. I was at dinner in 2015 it was, trying to move on with my life and trying to just find a way. And I get a phone call that my son passed away. He went into the hospital, and because of this, and the thing is, without this awareness, people suffer. And when they suffer and all this stigma that surrounds it, we have a high rate of drug addiction and alcohol abuse, and I can speak to that because I have been there with the abuse of drugs and alcohol. And I know what it's like to try to bury yourself so that you don't feel that pain, so you don't have to look at people. And, people don't get it. At times, it's such an intuition that you can see, you can feel what people are feeling about you when they look at you. And that alone can be debilitating. And I sat there at dinner and called, and they said, you know what? He put his hands behind his head and he gave up. And that's how he died. He went to the drugs because he couldn't talk to anyone. He couldn't tell anyone because he didn't know how they would feel about him. But what happened? He was provided the drugs to ease the pain. He was provided a way to escape, which led to his demise instead of him fighting. And if he had family and friends who really understood what it was like, and, we form our ballroom families, and yes, they're very strong, but there's still that bond to our, I would say, biological, the blood. Even though it's disgusting at times, it's traumatic, there's still that tie. And when your blood doesn't give you that kind of acknowledgement, even though we're looking for respect from our families, our immediate, we still look for that kind of acknowledgement. And when that's not there, when they look at you, look down at you, look at you with pity, start blaming themselves for what you're going through, thinking of them instead of you, scorning you, making you feel like now you're some project, blaming your lifestyle instead of saying this is what the world is because you didn't want to see this. Accountability is where we need to be.
Absolutely. I just want to ask one more question of you before we transition. That is, you talk to a lot of people. You interact with a lot of people, right? So you are in community spaces. You're in the industry. You're doing the work with the show. you have your modeling colleagues and associates. Like what are you hearing, and what are your thoughts about the similarities between COVID-19 and HIV?
Well, there are those that are very much opposed to both vaccines. And I come from a space of where if you have never experienced something, don't put yourself in those shoes, right? Or don't attempt to put yourself in those shoes and try to make decisions for someone who is actually living with it. What you're supposed to be doing is becoming an ally and finding support for them. So, but across the board, from my fellow actors, especially at polls, HIV and COVID is something we were very happy for the COVID vaccine. But with the similarities, it was like the world is like shutting down and people are dying. And the response, though, is different. Because with HIV and AIDS, people are still in that mindset that it only affects a certain group of people. But with COVID, it was affecting the world, just like HIV was. And because it was affecting certain communities, they strove and we got this vaccine today. And now we have to apply the same perseverance, the same determination for the HIV vaccine because it's been decades. Something must be done. And that's what a lot of, from India to MJ to everyone, most of us have all been very, very, very much involved with HIV and AIDS, just for the simple fact that it's so close and at home to us. So when we have conversations about it, it's about how can we help? What can we do? How can we bring visibility? How can we raise awareness? How can we let people know that this is not something, it's not about stigma. This is a human being also. Because you have to take it from this. I understand what it's like to be put down because I'm trans. I went through that moment of thinking I was HIV positive and refused to go get any kind of test because I just didn't want to know. Just let me die. And in 2000, when I got that test, it gave me a boost to continue my life, to want to live. But as I was getting to that train station and I stopped for a second and something hit me and it was like, wait a second. What if you had gotten that positive result? What about all those other people who have a positive result? I remember my son, one of my kids who was positive, when he told me, all of a sudden it was like he expected a difference. And I took his cup from him. We were at the bar and we were drinking, and I took his cup from him and I drank, and he was froze for for a moment. Like, Mom, what are you doing? I'm like, honey, it's about understanding and learning. This is not how you catch this. You're a human being. I can drink after you. We understand this. It's not about distancing people. So whenever many of the people I have come across have had these very same situations where they have had to come to the understanding of knowing and respecting that that's a human being also. We're all human beings. And that this is not something for you to go with the stigma. It's to give people support, be an ally. And I know how people treated me as a trans woman, and I want to be treated with respect. So therefore, I would want to give that to others. One of my mottos is always, do unto others as you have others do unto you. Now, I don't believe in double standards.
Absolutely. Absolutely. Well, I am going to take a moment and thank you for this piece of our conversation so far. And we're going to bring in some other folks to keep the conversation going, but want to acknowledge the star power of you and all of who you are here in this conversation. And of course, a special shout out to the House of Mason Margiela. So we can now bring in our other guests, experts. Yes. My sister.
Hey.
So we have, in addition to Dominique, we now also have some other family members. Kaida Mutefa, who is, in addition to being my sister, she's a Star Power advocate, clinical research expert, and a social worker, goddess, aka lots of identities. And then, of course, Dr. Bisola Ojukutu, who is an amazing physician scientist, Massachusetts General Hospital, Harvard University. And I've had the opportunity to serve on several panels with her regarding COVID as well. And she's completely entrenched. She's not just a physician scientist, y'all. She's in the community trenches, right? She's not just hiding behind a lab coat. She's connected to the people. And then, of course, the incomparable Matt Rose from Health Gap, who is also an amazing community advocate who works globally to support community access to research and also research literacy. So thank you all for joining for this important conversation.
Thank you.
We are here to talk about sort of the intersection of COVID and HIV. And because we just, you're still sort of celebrating, at least in my mind, HIV Vaccine Awareness Day, I'm really curious to hear from you all. What are the critical questions that you believe remain unanswered about HIV vaccines in communities? What are people saying? These are the things that are concerning to me. I won't even think about considering an HIV vaccine or an HIV vaccine trial until these things are addressed. What are those things?
I mean, there's the perennial question that I've gotten since I started in this field. We actually also see it in the COVID space as well, is, so this shot you want to give me, can I get HIV from it? Are you giving me HIV? Like, how does this thing work? And I think that a lot of that is based on how we classically view vaccines. You know, people remember we weakened polio, and we weakened smallpox, and then we gave them to people. Or really old school, they like rub a rag with smallpox and then rub that rag on you and see if you survived. We are so much more advanced in that in our technologies and our understanding of how to fight viruses. You know, to borrow an old analogy from the VTN folks, we can tell you kickstand, handlebar, and seat, and your mind thinks bicycle. That's exactly what we do with how we develop these vaccines. But so many people don't know about that. They don't know where the technology's gotten. They don't know that you can't get HIV from one. And they're like, I ain't getting anything that could give me something, Matt. I'm good. Why are you putting that in my body? Are you changing my genes? So that's probably the most classic one that I talk about and deal with every year for the entire life of my time, over a decade doing this work.
Absolutely. Anyone else?
So I'll jump in, and I think one of the points that I want to make, and probably will make several times, is that I'm not getting enough questions about HIV vaccines, and this is a problem. I think that there is low self-perceived risk out there in a world where we have such disproportionate, incidents within Black and Brown communities. I think that people, it's not on their radar anymore. I think that's it's a sad testament to what's happened. This is pre-COVID. I'm not just saying during COVID. It's like COVID is taking over. That's not what I'm saying. What I'm saying is that when people writ large feel like something is no longer of concern because it's only affecting certain groups of people in their mind, then it's not something that they even talk about. And I'm really glad that we're having this awareness day, that we had this awareness day, but the reality is we have lots of awareness days. So we need to really think about what's really going to mobilize us and push us forward. So that's my frustration. Is that we don't get, when I'm not getting enough questions about HIV and HIV vaccines. So,
and how do we put it back into the minds and hearts of people was so low. Like, how do we?
I would love to hear from my esteemed colleagues here, but I would say that one of the things that I try to do is really make people understand their risk. And secondly, to get people who are living with HIV to continue to talk to people, to overcome that stigma that's obviously still out there and engage, because we're still at that stage, in many ways, and people don't feel comfortable. I have a lot of women living with HIV in my practice, and to be very quite honest with you, this is another thing that I'm struggling with, is that a number of them haven't disclosed to anybody. I'm the only one, or my medical assistant, or my nurse. That's it. We are their family. You know what I mean? And they wouldn't come out to another group of women who are high risk, and talk. And so when you have that silence, the issue becomes siloed. And that's what frustrates me.
I'll say I am strangely hyped in this moment. And this is because, normally as a global health advocate, everything is just terrible to you all the time because you look at just insane numbers of people dying and people having adverse outcomes from disease. But so I try to pull for what are the strings that I can put some pearls on and slap a nice necklace and keep going. And for me, we are at this unique point where we now have people for the first time ever talking about adults getting vaccines. That just doesn't happen.
That's right.
We're like, oh, Gardasil, adults should do that. Maybe, I don't know. It stops cancer, but we're not going to talk about that. No. But now we're having a conversation of what does it mean to engage in public health? What does it mean to engage in research? What can a vaccine do to you? We're literally watching in the United States in real time what a huge scale up for vaccines can do to a population. And you don't see that anywhere else. And I think that we have to keep that momentum going because as Stefan gets the joy of talking about all the time is that and probably you as well, Dr. Priscilla, we have 2 big HIV vaccine trials going on right now that most people have no idea about. But you all are talking about vaccines because you're all either have gotten a COVID vaccine or considering getting a COVID vaccine or have just had someone bit in your face about a COVID vaccine. And if you haven't, let's have a conversation. But we're in this unique space where we have to figure out why do communities, especially our communities, not want to have these conversations? And what are the standards that they need to engage in these conversations? I often find that, the scientists are just well, we have data. Isn't this great? And I'm like, yeah, for you all, but that doesn't speak in the context of my life. When am I going to get a shot? What's it going to do to me? How does it affect me? And we are having some of these conversations with COVID right now. HIV is going to be a lot harder because it's not airborne, it's not everywhere, and it's always relegated to this how did you get HIV? What happened in your life that made this happen to you? And that's the kind of terrible stigma that we deal with. We're going to have to deal with some of that. Learn how do we bridge this conversation about vaccines forward, and then we can have that hype moment to be yo, I want to deliver you an HIV vaccine, and it is going to make your life amazing. Why? Because I'm going to give you something that you didn't even know you needed. The ability to not think about HIV ever. And I want to get you there. And then I want to work on that. I keep working on that cure stuff too. But I want to make it so HIV is off the table because I am reminded, and I'll shut up and let Kaida get on this in a second, is that we are about to hit June 5th will mark 40 years of us knowing about HIV. And in 40 years' time, we have told people multiple times that we would have a vaccine in 5 years, in 10 years. Let's actually deliver to the people what we said and make sure that the community is in a space to receive that information and be excited for that information. But that's all from that.
Kaida or Dominique, and then I will talk about 2 of the trials that Matt referenced.
I think my sister girl froze.
Well, Kaida, do you want to take it away?
Go ahead, Dominique. I think there's a weather situation in her location.
Okay. Well, one of the things that I really wanted to say was, as you were speaking about walking up to someone and being able to say to them that, wow, we have a vaccine, of course you should immediately think that the response would be, yes, I'm taking it. But what we really get, and across the board, even with COVID, even with family members, it was that whole idea of they're going to change my DNA. They're going to put this into me. They're going to put that to me. I think what it has to do is with education and, again, with where society has put us in this community, where people that are infected are saying, I'm already infected, that's not going to affect me. Those that aren't infected are distancing themselves from it. And so, again, there has to be that bridge, but we're going to have to get out there. And like Dr. Ojikutu was saying, you have to be able to make that bridge. And in order to make that bridge, you have to be in the trenches. You have to get out into the community, amongst the community, and listen to the things that they're saying. What are their fears? And then we have to try to debunk those fears and then get them to feel safe. I know for a fact that there are even trans women out there who will go to a doctor and not let them know that they're trans. But the stigma surrounding HIV lets us know that people will not disclose it. They will not even want to take an exam. There's so much surrounding it that people will distance themselves. I know people who have locked themselves away, gone home, detransitioned, everything like that, because there's still that thing around HIV and AIDS, because the conversations are there, but the scientists are on one side of the fence and the people are on the other. And we have to get that connection in order for people to realize that it is safe for them to take these vaccines.
Stefan, I'm back now. Can you hear me?
Yes.
So I live in New Orleans, y'all, and this is hurricane season. And so, yeah. First of all, Queen Mother, it is so good to meet you. I am honored. Oh my God. I bow down. But and a storm literally is passing. It just. So I think, Matt made it happen. That's what he does. But good afternoon, family. Thank you so much, Stefan, for inviting us all to participate in this conversation. And I believe your question was in reference to, in this present moment, the similarities between HIV and COVID. And for me, I'm a mom of a 13-year-old girl, a very, bless you, a very outspoken,
my twin. My twin.
Literally your twin. She's very, she has a lot to say. And so, and Dominique, you would love her because she's an amazing being.
Full of life.
Yeah, full of life. And so I remember I'm in the Moderna vaccine trial. And I remember talking to her pediatrician. I did this thing that, sometimes advocate moms do.
I think we have the connection issues again. I would really like to hear the story.
So if you want to know the story she's going to tell y'all, it's better coming from her.
Yeah.
Rita joined the Moderna trial because she wanted Black women to show up. And she said, how can I enroll people in this trial if I don't know what's in it? And so she said, I'm going to do it. But then she went with her doctor and her daughter and said, let me give you all the information to decide if you, my daughter, want to make the decision from your own space to be in the trial for children and figuring out what do you need and for your life, how important is this? And ultimately, her daughter took the information. She sat with it for a couple of weeks. She asked a lot of pointed questions because if you've ever met Kayada's child, you know that she's brilliant. She's gonna get her questions answered. And she ultimately decided that it was in the best interest of her and for her community, for her to enroll too. So you got a mother-daughter team. Not only have they do all the amazing work of being in the community, they've been dropping off food to folks throughout the entire COVID process, but both of them, after reading everything, listening, talking to doctors, talking to providers, getting their questions answered, both decided that they were going to help the research process along.
I think that's really important. I think about the point that you raised, Dominique, and you also raised it, Basola, about this, not just the stigma that exists around HIV, but also how do we create more conversation around it, that people are more interested in engaging in this sort of discourse. And I think that based on what we've seen in the COVID-19 space, that we really do need to see more people talking about HIV and HIV trials as participants to tell their stories so that they can help to build trust with other people to consider joining and participating in and just engaging in the conversations, even if they don't join. You know, one of the things that I often say in talks is that there are so many ways to support HIV vaccine research that don't involve participating in a specific trial. You know, it means educating yourself about it. It means talking to other people about HIV. It means potentially joining a community advisory board for a clinical research site. There's so many ways that people can really take part in this process. But looks like you're back, sis.
Am I back?
Yeah.
So until the storm comes back again, I'll speak really fast. So take my daughter to the doctor. She talks with her pediatrician, who's a white woman. She loves my daughter. My daughter loves her. And at 13, you know, parents can be asked to leave the room, right? Mm-hmm. And so she has this conversation with her. And my daughter says, yeah, no, I'm not interested in joining the trial. And the doctor said, oh, okay. I think she thought it would go differently. She said, oh, okay. Do you mind if I ask why? And she said, I'm just not interested. It's not my, it's my body. And then recently, when the Pfizer vaccine was approved for 12 to 15-year-olds, I said to her, are you interested in the vaccine? She said, no. And we said, okay. And I think for me and for Dominique as a mom and Dr. Basola, when you have young people to have autonomy over their bodies in a way where they can say yes or no, or let me think about it, that is huge. We have never been there. We have never been there. And when you look at, as children, she received the MMR, she received Hep B, Hep A, and as an infant, she didn't have a choice. She had two adults, a mother and a father, who said, this is what we need in order to get out the hospital. Give her the shot. Let's go. Give me the card. And that was it. We didn't ask questions. We didn't talk about who was in the trial. We didn't ask about effectiveness, tolerability, safety, dosing. We didn't ask about any of that. All we knew is we got our yellow card and we left the hospital with our child healthy. Now that she and her peers have the opportunity to have autonomy over their bodies. Like, no one can make you do anything you don't want to do. You do it when you feel ready to. And I, although I would want her to think differently or another way, the fact that it's her mind, it's her body, it's her decision. Now, will it change? Possibly. As she learns more and more about the vaccine, as more people her age acquire the vaccine or choose to take the vaccine or just to have conversations about the vaccine, we're raising a whole new generation of young people who now we can actually go to and say, can we talk about an HIV vaccine? Okay, sure. What will it entail? Right? What would it take? We didn't have that. Just 5 years ago, we didn't have that. So for me, HIV Vaccine Awareness Day, I started Merck. Today is my 7th year at Merck. And I started Merck, it was May 19th, 2014. And I remember going to a Black AIDS Institute gala, the Heroes in the Struggle gala, when it used to be in the spring. And Dr. Fauci was at the gala and sitting on the front seat, and we were sitting directly behind him. And Matt knows I'm a Dr. Fauci, groupie. I don't know what to call it, but it's not. It doesn't require restraining order, Dominique. It don't require restraining, but it's a little close. So I whispered up to him. I was like, "I love you," and he was great, thank you. And this was 7 years ago, but it was around the time of HIV Vaccine Awareness Day. I remember that because of all of the hype that was around that particular Heroes in the Struggle. And I say that to say 7 years ago to where we are now, huge advancements, right? Huge advancements. However, for me, the biggest question and the question that I believe that is yet to be answered is, are they worth it? Are they worth it? Are they worth it? Whoever they is. The 35 million that Dominique talked about earlier that have passed on, are they worth the vaccine? Are their descendants and their children and their communities and their families, are they worth it? Because a COVID vaccine was made available because it was determined that somebody was worth it. I didn't develop it, but somebody determined that somebody was worth it. I believe it begs the question, are they worth it? And if we look at the work that Dr. Basola is doing in the U.S. and around the world with young women, yes, they are worth it. Young men, yes, they are worth it. The work that the HBTN is doing, yes, they are worth it. And I think we are past the time of trying to convince anyone that they're worth it. So worth it means we do exactly what we did for COVID. We streamline. We do not work in silos and in competition. We prioritize what's most important, which is human beings. And more importantly, that we tap into the talent, the brilliance, and the expertise that have existed and interfaced with communities far too long, that have been really overlooked and overstepped. I'll be quiet now while the storm is.
Thank you all for that. I will just dovetail by talking briefly about two large-scale trials looking at HIV vaccines. One is the Imbokodo study. It's happening in sub-Saharan Africa, and people can learn more about that by going to hbtn.org. And this study is in women in Southern Africa, and it's looking at a vaccine sort of platform or style of creating a vaccine that takes into consideration the different kinds of HIV strains that are found around the world. And then there is a comparable study, we call it the brother-sister study to that, that's happening here in the US, in Mexico, Peru, Argentina, Brazil, and in 3 countries in Europe, called the Mosaico study. And that study is in cisgendered MSM, that includes trans men as well as trans women. So that study is currently enrolling, and certainly people are, the clinical trial sites that we are working with are looking for volunteers. So mosaicostudy.com for that one. And I think it's important because that one's using a similar style, right? It's the idea that we can design a vaccine that includes a consideration for different kinds of strains that you might find around the world. And in addition to that, we're also, the HIV Vaccine Trials Network is also looking at how we take this mRNA platform or style of creating vaccines, and how do we apply that in the HIV vaccine space. So there's a lot that's happening in this space, but I would be remiss if I didn't agree with everything that was just said about the commitment. And, I mentioned, I think at some point during the interference, Kaida, that I think this is a call to action for not just advocates, but also communities broadly, and also the research enterprise. How can we do this? And as you said, it's time out, for all the talk. It's time to make this happen. And the communities are worth it. We all are worth it. So thank you for that. Thinking about, again, sort of COVID-19 vaccines and HIV vaccines specifically, it would be interesting to hear any other thoughts that you have about the trials, the communities, perspectives. So yes, we want to hear it all.
Oh, girl. On this topic. First and foremost, I want to say that it is amazing, as much as everyone says it's amazing and how fast we were able to get a COVID vaccine. That is some breathtaking science. Some of that science, a lot of that science, is based off of work we did in the HIV space to identify platforms and technologies that allowed us to get there, because our virus is just harder, straight up. Like, HIV is a really challenging, really difficult, really complex virus. Always changing, changes at way faster rates than COVID. But the things we built in place because of HIV helped us be able to test things for COVID. For those folks who are on House Moderna, like myself, your vaccine is made possible by the fact that we had an HIV Prevention Trials network whose sites transformed themselves to do COVID research and COVID vaccine work. That's why Stefan, he's always wears multiple hats, but this is responsible for at least one of his extra titles is because of this. Also, some of the things that we've done in the HIV space bled over to the COVID space to force critical conversations that we would not have had otherwise, or that we were even able to get into the room to yell at people for. And I say that as someone who was in the room yelling at the Dr. Fauci's actually not yelling at Fauci. I haven't yelled at Fauci in a year and a half, and I'm very proud of myself for that. The whole new nature of our relationship. But I say that to say, last fall, for instance, when Pfizer did the big announcement, oh, we don't have enough Black and Latino people. And then all the other trials were like, oh my God, what happened to the Black and Latino people? We said, because you did not prioritize them. You knew where this virus was. You knew who was being affected, who was being effected. And you chose to say, we're going to go with the people who are easy to grab, that we've always gone for who are easy to grab. And we are seeing that process play itself out over and over and over again. The difference now is more people at least want to pretend to have the equity conversation, and you're seeing it actually play out in the HIV space. So one of the other trial networks, the HIV Prevention Trials Network, just finished this big study on injectable PrEP. They mandated in the United States that half that study had to be Black. Point blank, no exceptions. You had to change your recruitment. We've seen it with ViiV, has done it in some of their injectable studies as well, saying that 30% of this trial has to be women, which is just a novel concept that you're like, wait, we can mandate that you have to have a certain number of women in the United States? Oh, I guess we can. I guess that's a great idea. Or even better, that after forever in a moment, we finally recognize that trans people exist. Trans people have healthcare needs. Maybe we should enroll them in trials at significant numbers so they can actually know what's going on with this product in their community. And some of those gains translated over in the COVID field. Some of them weren't in primary papers of analysis, but definitely some secondary studies that looked at some of this stuff. And so we made inroads. And a lot of that is because we have boisterous HIV people who are advocates, researchers, and activists who make their mark on this field and continue to make this mark on their field, and it's felt in other spaces as well.
And Matt, I would like to echo what you just said, because, we have two researchers on this panel who I'm sure they can attest that although everything that you just said is true, there's a missing component, right? Which has been them. Right? So, because you mentioned the equity conversation, we're not even there. Like, let's be clear. We're not at diversity and we're not at inclusion. To me, when you're looking at that in its purest, most transformational form, it will include Dr. Bazzola sitting at the table and being a co-PI or a lead PI and not receiving an MOU. So for those in the audience that don't understand what this means, I'll break it down for you. So oftentimes what happens in research is that, you know, like how, and I call her Dr. Bazzola by her first name, but Dr. Bazzola will have, you know, all of this credibility. She's published in the Lancet. She is published everywhere. She is the epitome of what we want in science, to look at diverse communities, but we don't include her, right? We don't invite her to the table. Why? Because of the fact that she doesn't look like so-and-so. She doesn't act like so-and-so. She doesn't exhibit interest like so-and-so. So as a result, she's not considered the primary, and I'm just putting her out there, not considered the primary person to lead the research, but oftentimes not even the secondary, right, Matt? Or the tertiary. It's usually, can you please come comment on this panel about the research we've done already? So when we start talking about real equity in HIV vaccine research, the equity must begin with the researchers that have and that are boots on the ground, that have roots, for lack of a better term, in communities. Right? That have the relationships as well as the connection, and more importantly, the understanding. I think that's what we've learned about the diversity and inclusion and equity space, is that it's not about knowledge attainment. It's about true, authentic understanding and how that's displayed. Right? I could never be a house mother. They'll be like, she tripping over her own 2 feet. It would not be cute. It would not, and I wear a size 11. It would not be cute. However, that's right. However, Dominique can do that and do that well. Right? I can't do that. That's not my lane. But me being able to defer, to take a line from, you know, the advocate Gina Brown, who's from New Orleans. Gina Brown is always about, this is not about me anymore, right? This is not my time. This time belongs to my trans sisters, my cis hetero sisters who don't know that they are in the line of possibly acquiring HIV. This belongs to everyone else. This is not about me. And to me, that's equity, right? That's the sharing that comes with it. So we have a long way to go. We have a long way to go, but I believe that this COVID experience has taught us that anything is possible. No is the exception and not the norm. And that is something we have to remember, especially those of you that are researchers. No is the exception and not the norm, not anymore. If someone tells you no in 2021, you're like, that's outdated. That doesn't apply here anymore.
Yeah, I just absolutely love your energy, your spirit, everything. And much love to you and your daughter. Hugs and kisses. And I just want to just emphasize what you just said, the importance of what you just said, because in having people on the ground, I remember back in 2005, I spoke to some doctors who were doing their research about our community, about ballroom, you know, trying to do their PhD, their thesis, whatever. And they came into the community, and it was about, we decided that we were going to do this thing where we went into the clubs and we got tested. And they could not understand why, when they did it without me, that no one spoke to them. No one even looked in their direction. And they were offering money. When I came on, I said, listen, you have to change the way that you're looking at this, because first of all, people are out here partying. They're out here trying to have a good time to get rid of the situations that are going on in their head. And now you're going to stick an HIV test in front of them, give them $20 and a movie ticket, give them a positive result, and then send them on their way. Right. And in a way, that guilt kind of resonated with me, because I felt like I got my people into this study. But what I also did was they had to link them to organizations. They had to link them, so you couldn't just give a positive result and send someone on their way. They had to be cared. There had to be something. And then after a while, I got out of it. And we realized that it was destructive. But I say this because when you see someone that is like you, that knows you, I can even make the reference to when they tried to have groups for transgender people at GMHC. It was like, your name is GMHC. You're making no effort to be inclusive, but you want to have groups that talk at us instead of having us tell you what we need. And I find that a lot of time with research, and especially with vaccinations, and from what I hear throughout the Black and Brown community, they don't trust these people. Because of all the racism, because of everything that's happening, you're not going to find that a white privileged person is going to come in and pretend like they're on safari in Africa and saving the children. We don't need that kind of dynamic anymore, because we know that our own people can do the work, right? When you want to address youth, you have to, we got into the programs of having youth that have gone through these things come and address them. We have to learn how to step aside at times and allow the work to be done. So therefore, for Dr. Basola or Ojikutu, it is important that you are able to be at the head of this research, because you know this is something you are invested in. It is important for all of our scientists that are Black and Brown to be included. It is important for all of us who have experienced to be included. You know, and we're not going to just go talk to someone who's going to try to put something onto us. And that is one barrier that will always exist. Even with COVID, you still have people that are Black and Brown that are saying, no, they're trying to change my DNA. My fiance is on Facebook reading these comments all the time, and he almost didn't take it. Because as a community in certain spaces, we protect each other to the point of saying, look, you're going to grow wings. And we believe it, because we have never been able to trust these people. But when you see the girl that grew up with you, and yeah, you went one direction and she stuck to her work and she studied and she made it. When you see her standing in front of you, there's respect. There is trust. And in order for us to have trust, our people have to be at the helm in order for us to participate.
So let me jump in here, if I could just jump in and say something, because I think what Dominique just said, what Kaida said, what Matthew said, so important. Okay, then there's so many levels here that we could tease out. I think we need to get real, though, here. Research is a lucrative business, okay? And if you want people to move out the way, that's going to cause some challenges. This has been a star-making industry, this HIV medications, antiretroviral therapy, vaccines. We're going to go back to talk about, I don't even want to get into the amount of money the pharmaceutical industry and the researchers making on COVID-19 vaccines, okay? Now, when you talk about who are you going to include in that process, who are the people who are going to be PIs, then you're talking about really shifting power. That's the essence of structural racism, right? Mm-hmm. How does that happen, and who really wants to do that? And this is why I appreciate what Matthew said when he said people are talking to equity lingo or whatever. You know, we can talk a lot about equity, diversity, equity, inclusion, but it's really when you're ready to shift power, that's when we're ready to get serious. That's real. And I think that's the stickler with what's happening here. And that's what we need to keep our eyes focused in on. Not getting some, resources here to do this, not getting some da-da-da-da to do that. Who is making the decisions? Who are the real PIs? Who are really developing the research questions? Who are truly within that research enterprise? The research enterprise is academia, government, and, pharmaceutical industry. You know what I mean? Is the community really, are they part of that tripartite, that triangle? Okay, so we have to think about what we want to do differently. And I have had these conversations with a number of people, Black and brown and white. And I think Matthew is right. We are at a critical moment where if we're going to talk this equity talk, we need to push the envelope, and really start talking about how do we truly redistribute power so that other people are not just the researchers, the doctors, but it's also the communities who are involved are not just run to do outreach, to do enrollment in studies, but they're actually at the table from the very beginning, that we're developing true partnerships, that we're really investing in those communities and building health literacy, scientific literacy, so that we're building a stronger pipeline so that the future looks brighter than what it already is. We already have a good pipeline. We're just not at the table, but we can make it stronger. That's my point.
I think the other point to this, particularly when I think about structural racism, is really rooted in epistemology and the way that we understand and place value in knowledge. And what is knowledge? And how is knowledge attained? How is it shared? And more specifically, who determines the value of said knowledge? I think about the reality that a lot of the people who do research in our communities do not look like us, and they're consistently being funded to do this research. And they're also the ones that are consistently, published, because that is a whole other sort of dynamic, right? Not just who gets to submit the publication to the journal, but whether the journal actually accepts the publication. There's been quite a bit of research done on the fact that publications often don't include researchers or include research that looks at specific populations, particularly when you use certain words like racism. So there is an enterprise here, and I completely agree with how we think about any efforts to address equity have to also look at the structural components to this work.
And if I may just give a quick shout out to Stefan. I mean, I can name them by names: David Malbranch, Greg Millett. I mean, just so many people. Michelle. I mean, just so many of you all. I remember at the beginning of this pandemic, and Stefan remembers this, like me constantly emailing and texting, please don't give up. I know this is hard right now. Please don't give up. Like, I know the storm, it's like, I live in New Orleans, and they say when the eye of the storm is upon you and everything is peaceful and it's quiet, right before it breaks is when you have to persevere and really arm yourself and protect yourself. And I just wanted to let all of them know you are loved. I have a child. I have nieces and nephews and other people that I love that need your brilliance right now. So whatever you need to do to shelter in place, please do, so that you are prepared for the storm. So thank you, Stefan, because of your work and a lot of the work of the VTN, and especially the African-American folks at the VTN, at the HPTN, at the various networks. That's why we have even an NIH investment in communities right now, being able to focus just on vaccine awareness, health equity, education. We have that because there were a group of people at the beginning of a pandemic when they could have said, you know what, I have my PhD. Let me go sit down somewhere. They said, nah, I'm going to fight for the people. Dr. Basola still being there available for her patients, right? If it were not for y'all, and I think you guys are living legacies, living ancestors right now, because if it were not for you all, I do not believe that there would be a presence or even a response that is specific to Black and Brown and trans communities right now. So thank you.
Thank you for that.
He doesn't like gratitude. It's okay. I'm sure all your sons are like, yeah, my dad does not like any gratitude.
I'm a work in progress. What did the elders say? God is still working on me. I am reminded in your comments, though, Kaida, that in addition to my appreciation for them, I'm reminded that there are people who took nothing and made something so that I could be here. I remember, and I'm not going to make this about me, but I am for a second. I remember paper food stamps. You know, before
purple,
this fancy,
it was purple, brown, and red, right?
Yeah, and you know the colors represented denominations, right?
$5 was purple. I remember that, and green was $1.
Yeah, and before this fancy, you know, newfangled, you know, debit card stuff that's going on. And I just reflect on my journey, and to circle back to your comment, there are people who did what they needed to do and what they felt like they had to do in order to make this work for me. I feel like it is not just an obligation. It is literally a cycle of commitment to ensure that we do this for our people, that we do this for our children, that we do this for our communities. So the work that's been done, and I know Basola is intimately familiar with the long hours, that this is a labor of love because this is a part of who we are. You know, none of us that I know of that look like us got into this work to be rich. You know, this is really about saving lives because at some point there were people there to help save ours.
You're gonna have me crying.
Absolutely. Stefan, that was well said. Very, very well said. Nothing motivates. You know, obviously we all have opportunities. You know what I mean? When I say all, I mean there are options people have in life, right? And you know, I remember when I decided to focus on HIV and infectious diseases, I knew that my work was not going to be, you know, it wasn't going to be lucrative. I wasn't going into it for that. I saw people who look like me and my relatives, my family members, people I know, my friends dying. You know, this was like late 90s, early 2000s. People were still in an AIDS ward. You know what I mean? And it hurt. And it hurt because it was the root, sort of the end of all the things that were wrong in terms of access to care, substance use, you know, disproportionate access to treatment for substance use. It's everything, you know, it's just wrong. And then this is what it results in. And to me, that's the beauty of the work. And I would say that this is not just about doctors and scientists. You know, this is about advocates. I mean, I have, you know, you all know there are advocates we can point to who, you know, become sort of national names. There are people who haven't become national names, and we know they are living, breathing. They roll out of bed every day, every morning, and they say to themselves, "What can I do to move this agenda forward?" You know, just people are passionate about this work, and that's the beauty. That really is the beauty of it.
I think we can all collectively say Ashe.
Ashe. And take a deep breath.
That's right.
Take a deep breath.
There was I always remember my first kind of big time in the research side of this field. I flew across country on a red-eye flight, which I thought was so cool because I was a 21-year-old and I didn't need no sleep. And I went into a VTN plenary and fell asleep. Death by PowerPoint, it happens. But I kept asking questions. I kept demanding questions get answered. I watched a mentor of mine make someone cry from the podium because she would not say why this study needed to happen in our community, but yet the study was being pushed that our community need to be at front and center, but they weren't doing anything to make sure that our community could be involved in the decisions and the discussions. And
I remember that session.
I bet you do. And we pushed forward. And, in that moment of watching all of that and experiencing that, I kept pushing forward. And with a lot of folks on this panel, we've pushed and changed things. I can say that as a person who sits on the executive committee of one of the trial networks, has harassed the executive committees of most of the other trial networks and gotten them to change, gotten NIH to bend on things, that we can make things different and watch the progress, watch the junior investigators start moving through the ranks, watching more people like me, people who I recognize, know, and love, fill these circles of power, get their studies funded, and shown that their research does change the trajectory, and know that those learnings and who, as we said earlier, who is producing knowledge, who is documenting that knowledge, how that knowledge gets spread back out to the community is so vitally important. One of the people I love talking to about research, nerdy research thing is Mitchell Warren. He's the executive director over at ABAC. And he always says, Matt, one day we could potentially have a 99% efficacious vaccine that nobody wants to use. And that's why community has to be in the discussion. And that's why we need researchers who don't just show up to community when they think they have a study ready, but show up to that community because they know that the community is highly impacted and talk about what do they need. The people who show up, who care for their patients constantly, who are there as part of the community and not only bring their research hat, but bring community members with them into these conversations. And that is the legacy that we build that will make an HIV vaccine happen one day, but also get rolled out in a fair and equitable way that makes sense to the people who need it most. And that's kind of what I fight for.
I think it's really important that you said that, because I was just talking to a colleague, I think you may know Matt, you might also Kaida T.N. Johnson over at Barg. And we were talking about the global application of racism and the overlay of that with the limited access of COVID-19 vaccines in international settings. So I completely hear that, because I think about that, like, you know, whether it's injectable PrEP, whether it's an HIV vaccine, like how, in addition to ensuring that there are people who look like us that are, you know, intimately involved in these trials, intimately connected to designing and implementing them, right? But that there are also people who look like us that are a part of designing the protocols and the procedures regarding access, that are, you know, involved in the policy level conversations around how this is going to get paid for, so that people don't have, you know, these extra barriers. And these extra considerations. You know, if Black people are being systematically impacted by various infectious diseases because of structural racism, but we don't give Black people access to the very treatments that are needed to resolve these disease complications, then what are we ultimately saying about the value of these communities? And we can't do double talk. We can't do double speak. Because what's clear to me is that the people are tired of the shit. And I can say that.
Exactly. That's right.
The people are tired of it. And it's like, you know, as one of my friends, the icon Jay Blahnik would say, either you're going to shit or get off the pot. Mm-hmm. Mm-hmm. Yes. Have a COVID-19 vaccine so fast, we should have an HIV vaccine. Anybody interested in speaking to that? I have some thoughts as well. I know, Matt, you and I have talked a lot about this.
I mean, Matt was ready. He was at the gate. Like, as soon as Anthony wrote it, he was like, shh.
There's the long question, there's the like simplified short questions, and then there's like the real talk. So I'm actually gonna give you the real talk. The real talk is we poured a whole bunch of resources that we've never poured into a virus before to build off of research that had already been happening for over a decade. And from the biological standpoint, we know a lot more about coronaviruses and how they function than we do about HIV in some regards. And that's partly because of how the virus mutates and the speed in which the virus mutates and what pieces of the virus keeps even when it mutates. So like things that we can identify. So if you've seen the coronavirus, that kind of image they give you, it's this like orb with these like cone shapes around it or crown shapes around it, has corona. I know, right? They're so sophisticated with their naming. But we know that spike does not change. We had done a bunch of research on that spike because we'd already seen it with SARS and we'd already seen it with MERS. We've also seen it with other coronaviruses that cause the common cold. HIV mutates really fast, does it a lot, integrates itself in host cells, attacks the very immune system that you need to defend yourself from a virus, because, hey, white blood cells, these are our favorite targets for HIV. And so that just makes it more difficult. But it is hard to think that like there are some things that I've always asked for that we're like, we don't have the money to pay for an adaptive trial design for HIV. That's so hard to do. And in COVID, we just stood up massive trial after massive trial after massive trial. So there is some shit to it. It's also who it affects and what they think it's going to slow down. If the burden of HIV caused, $30 trillion to the global economy, people would move a lot faster. And also, for the most part, people see HIV as still affecting those who are not, the highlight of people's lives, right? Like the marginalized folks. So it's your queer folks, your young women in Africa, the people over there.
The moral, they call them moral misfits.
Yes. Misfits. They used to say it was the 5 H's, the hemophiliacs, the whores, the homosexuals. I'm forgetting some others. The Haitians and something else. All kind of nonsense. But it's like whoever society can and by society, I mean dominant white male society deems less valuable, gets less focused. But coronavirus affects white men and they can't really protect themselves from it that well. So we cared a lot about them. So that's the shit of the story, the long version. The short version is it's an easier virus to deal with. But it's not just the easier. It's about decisions we make around funding, about research we decide to support, and who we think is going to be valuable for us to put research dollars in, and what communities we want to have things for.
And Matt, I would also add to that. Yeah, I would also add to that. It's also interesting, who, how our sex. Not the sex or our orientation, but how we have sex, right? And the value that's placed on that. So I always say, I really wish Shonda Rhimes would have done a better job at incorporating HIV messages into Olivia Pope's life. Because Olivia represented, what HIV could be. Right? The whole show represented that. You look at Grey's Anatomy, there's more sex that happens in Grey's Anatomy than what happens probably at a house or a ball in one episode. But that sex, that's good sex. That's safe sex. That's beautiful sex. That's, we're exploring, right? I've never seen a condom pulled out in Grey's Anatomy. Never. Only when a patient comes in that may have been exposed or someone living with HIV. So I think, when the populist conversation starts to really shift, Matt, where it's everyone talking similar to opioids, right? Stuff when I grew up in LA. What happened in crack cocaine, right? Dominique, the crack epidemic. We didn't have any. I haven't seen one lawsuit from the crack epidemic. I need a payment. I grew up in a crack house. I need some retribution. I need something because there was nothing done. And we have oodles and noodles and pounds and mountains of research about the effects of crack cocaine on our communities. But we have not got one check, right? One area of research other than crime prevention or gang prevention.
We have this massive increase of incarceration, of course.
Oh, yeah, that too, right? And so that's the ongoing clinical trial. Or, that's the ongoing clinical trial. Let's just see what happens when they get 60 and we have to let them out.
Yeah.
Right. So I think it's really important for us to just take stock of what's real. And as long as the way we exist, have sex, coexist, to whom and how, it will always be demonized, immoralized, dehumanized. But when it affects the masses, it's a whole different story. And that's what COVID presented to us. It affected the masses. And I said to people during COVID since the beginning, just watch what the wealthy people do. If they're not going outside, don't you take your butt outside.
I saw
if they're not doing that, I didn't see Jeff Bezos flying all over the world. He sat. He's gonna hold tight.
I saw suburbia trip over themselves to get into inner city communities, Black communities, brown communities, to take up vaccination slots.
Yep. And it was also codified as volunteers.
Yeah.
Leave that alone.
Yep.
Right.
Yeah, I'll go volunteer over there so I want to listen. What y'all doing? How y'all doing? Oh, they don't want it? I'll take it. I'll call my friends. Versus, let me go over here to the Popeyes and talk to everybody that's standing around there asking for food to say, hey, they're giving out vaccines across the street.
Right.
Absolutely. We are near the close of this program. Unfortunately, I feel like I can talk with you all in this way forever. One down, please. Left arm, best application, or maybe on the right. It could be in either, actually. It can be in either arm, Omar. But thank you for that question. Thank you all for sharing time, space, your hearts, and your spirits in this process, not just in this conversation.
Stefan, absolutely. I really appreciate this. This was a real conversation. You don't understand. The conversations I end up having, they're just not real sometimes. Sometimes I'm sitting on panels and I'm like, nobody's really saying what is, and it almost warps your own view of what really is. It's like, I really just appreciate you all. So I just want to say that. Sorry, Stefan. I want to step on your energy.
And Matt and I know this is temporary, because we've been loud for a long time.
Right. We'll move us to the back like usual, Kaita. And the room will close just when we start standing up. No more questions.
I mean, we all know it. There's a season, and this is the season. And I swear, harvest. We're gonna see what happens in the harvest.
I'm with it. But again, thank you all for your time and for having the real conversation.
And shout out to one of the most amazing advocates in the planet, Penny, that's my girl, man. I met Penny when I wasn't even talking about HIV. Dr. Basola was saying those advocates what people don't know about.
Yes.
Noble, come to New Orleans.
Absolutely.
New Orleans, you'll get them all, right?
Absolutely.
Right here, as they say, right here.
Any
TD, Dominique, as they say in New Orleans, TD. If you ever need to come to hang out, I don't know if Southern Decadence has happened, but there's always Southern Decadence at the Mutepfa family home. So, and my brother who's listening, he said he had to get a date with you, but don't worry about that.
Beyonce may not like that. But I thank you all so much. And this has also been very informative for me. And now I can go out. And when I speak to people, I can give in more information. I can educate them, and I'm going to be looking for all of you in the future, because as we go out there, we continue. And I just have to just make this one point. Kiara, it was so amazing to me, because you brought a new reality to me when you said that talked about all the sex that they're having, but they're not representing or showing up, or you never see a condom pulled out. And immediately I started to think about television on a whole, and we don't see that.
Yep. Nope.
we that narrative is not there. We do not teach that, and then we expect for all of these people, especially our youth who are watching this, like I've always said to some people, we want to understand love and intimacy, but we're learning about sex not from those who sit and talk to us about intimacy, but from going online and seeing what they do. So now we have men constantly going through this thing of sex as being their power and all of that stuff. So when you said that, you really spoke volumes, and I really appreciate that. And I appreciate, and it's Stephon, I'm just so in awe of you. I'm in awe of each and every one of you, listening to everything that you said. You are the true stars. You are the heroes for showing up, for being in their faces, for being there. And now I get to take everything that you have said, and I get to relay that to my counterparts, to my peers, and, really, really understand, because COVID versus HIV is also something, because for many of us, it's like, well, is it shade that the COVID vaccine was developed so quickly and you can't find a vaccine for HIV and our brothers and sisters are dying? But Matthew, from what you have been saying, it really, speaks volumes to the fact that this has been in progress. It's now for us to continue to fight. And Dr. Basola, for all of your work and your research and the inclusivity, and, wanting to push this as a way for women to be able to bond and get together and know that we shouldn't, just the mere fact of women being able to speak to each other breaks down those barriers that we are taught to always live in competition of each other. And that is something I have swore to never live by. So it's about educating our women and letting them know that it's okay to share. It's okay to protect each other, to provide safety for each other, especially when it comes to women that are marginalized, oppressed, and especially trans women. So thank you all very much for your work. Stephon, I will forever be proud of you. I'm proud of each and every one of you. And it makes me feel so safe and comfortable to know that you're at the helm, you're doing the work, and that you understand this community and us, because you are us.
That's a lot coming from Queen Mother. Thank you.
Thank you. I just want to give an opportunity for Madam Basola to give final thoughts. I'm taking your comments, Dominique and Kaida, as your final thoughts.
Basola, do you want to?
No, go ahead. Go ahead, Matt.
I want to always thank Stephon for having opportunities to help democratize knowledge. I think it's so important that we demystify what's going on. We set around facts. I do not sit at these boring boardroom tables and on hours of Zoom calls for the people who I'm accountable to not hear about what's happening. So always happy. Thank you all who are watching for showing up, for listening. I know the subject is a little nerdy, a little heavy, but it involves something that we all want to do, which is have hotter, wetter, better sex, and not have to worry about anything else besides our pleasure and our enjoyment. And we're trying our best to get you there. And just thank you for holding up as we try to get you new options so that you can always make an informed decision, whether it be an informed yes or an informed no, but at least it's an informed decision. So thank you all for showing up. If you have any questions, send them to Stephon. You can follow up with me if I need to answer any.
Don't email me.
That's how we do. Thanks so much, everybody.
Thank you, Matt.
I already said that I really appreciate that this is a real conversation. And for me, that's refreshing. I appreciate Stephon so much for all the incredible work that he's continued to do, just tirelessly, really, just truly, truly tireless. And so knowledgeable. Just really, I want to see you, sort of vault to all sorts of levels. And I know it's there, it's coming. So I so appreciate getting to connect with Kaida again. Just your energy, your spirit is really it's motivating me. I'm going to have a good rest of the day, rest of the week, even though I feel like it's Friday already, because you have really motivated me. Getting to meet Dominique, you're beautiful. Your smile is just radiating through the screen. Again, that's just motivating me. The things that you said, the fact that you've been so open and sharing, that to me is just, it doesn't happen. And I think that's what I even started out with, that some things just don't happen as often as they should. So I just appreciate that. And I want to get back to Matthew, though, because I really appreciate everything you said. But when you said at the beginning that this is a moment that we need to build on, you really hit an important point. This is a moment that we need to build into a movement. We really need to take this whole vaccine, COVID vaccine particularly, thinking about that and all the energy, the health literacy that's building, all the mobilization, all the community engagement. And we need to expand that into a movement to really look at prevention, care, treatment, really looking at holistic care within our communities. If we don't do that, we missed it. We missed a prime opportunity. So, thank you for this opportunity to talk. I would love to stay in contact with everybody. Again, send questions to Stefan, and he will ask.
No pressure.
He wants to respond.
No pressure.
Thank you all. I have a lot I can say about this panel. It's probably one of the best that I've been a part of in my entire career, actually. I appreciate every single last one of you. This has been an experience that's also given me, in addition to perspective, it's also energized my own personal sort of drive and advocacy. We are worth it is the theme that I would love to leave us with. And there are concerns in our communities. There are people who have questions, they have doubts, there's distrust, and there are lots of other things that are happening in our communities. And I think that, as Basola mentioned, this is an opportunity to turn those concerns into questions that can help drive conversations, that can help drive movements and policy change. So this is an opportunity for us to be engaged, and for those who aren't engaged to get engaged. And that does not necessarily mean that you need to be joining a trial tomorrow, or that you need to be getting vaccinated today. But it means that the more that we're in conversation with each other, the more likely it is that we're going to get to a point where we're all working towards the same goal and see the accomplishment of the end of HIV. So I look forward to celebrating this milestone with you all at some point in the future. And I look forward to connecting with you all in person at some point in the near future as well. So thank you all again. I appreciate the opportunity to be here to facilitate this. This feels like a family conversation and much less a panel discussion. But I'm also hopeful that those who are participating and attending, whether they're doing so live or they listen to the recorded version, that they take something from this that can help to reignite the truth about who they are, and that is that they're worth it. Thank you to our collaborators, United We Rise, blackdoctor.org, for your continued support. And on behalf of the HIV Vaccine Trials Network, wishing you all an amazing day, rest of your week. Take care.
Be safe, everybody.